The World Health Organization in the Eastern Mediterranean region works closely with many partners to achieve progress in its identified 5 strategic priority areas. WHO and its partners have shown that they are all united for health.
أعلنت منظمة الصحة العالمية أن مرض شلل الأطفال المعدي قد ظهر في شمال شرق سوريا في مدينة
WHO declares the spread of polio an international public health emergency.
التأكد من أول حالة إصابة بفيروس كورونا.
Ebola is at its most infectious on dead bodies of its victims.
In the past year, communicable diseases have dominated the public health headlines. Polio outbreaks and continuing circulation of poliovirus represented serious setbacks to the polio eradication program. In a show of unity and solidarity, member states pulled together and agreed on action. WHO and UNICEF, together with ministries of health and other partners, vaccinated more than 25 million children under 5 in the Syrian Arab Republic and 6 neighboring countries.
فيجب على الآباء والأمهات شرعاً أن يطعموا أولادهم بنات وبنين ضد شلل الأطفال.
Establishment of the Islamic Advisory Group resulted in strong support to reach children in districts where militants have banned immunization and attacked health workers.
وهذا التطعيم حق للطفل.
WHO has worked closely with member states to ensure a coordinated response to Middle East respiratory syndrome. Several member states have yet to fully develop core capacities for implementation of the International Health Regulations IHR 2005. Weaknesses in surveillance, control, and response continue to pose a challenge to health security in the region. Treat more, treat better was the regional slogan for World AIDS Day 2013. HIV treatment works, but coverage with antiretroviral therapy in the region remains the lowest in the world, reaching less than 20% of those in need. World Health Day raised awareness of the threat posed by vectors and vector-borne diseases, encouraging people to take action to protect themselves under the slogan, "Small bite, big threat." Immunization Week was a great success with immunization activities taking place in many countries. This year's slogan for the regional campaign was "Immunization for a Healthy Future, No, Check, Protect." Viral hepatitis is one of the most common and serious infections in the region. The World Hepatitis Day campaign urged individuals to care for your liver, think about hepatitis. WHO, UNICEF, and UNFPA, in collaboration with member states and other stakeholders, jointly embarked on a regional initiative on saving the lives of mothers and children. 9 member states are accelerating action towards achieving Millennium Development Goals 4 and 5 with commitments at the highest level of government. Nutrition interventions are part of the acceleration plans. These include supplementation with folic acid and iron and establishment of centers for treatment of severe and complex cases of malnutrition.
In countries where there's been malnutrition in the past, the babies that were born during that malnourished period are far more sensitive to developing diabetes and high blood pressure and heart disease 20, 30 years later when they put on weight.
In July 2014, world leaders gathered at the United Nations General Assembly to assess efforts made to implement the 2011 UN Political Declaration on the Prevention and Control of Non-Communicable Diseases. Our region provided concrete recommendations, most of which were included in the outcome document. Much has yet to be done to overcome this silent epidemic. The promotion of physical activity received strategic attention. A multi-sectoral ministerial forum held in Dubai in February 2014 brought together policymakers to promote physical activity and show a united front for health. The outcome is a clear roadmap for countries.
It is clear that physical inactivity and addressing this problem will improve health and well-being, and there are many co-benefits which we will talk about. There is a need to act, and what we must now focus on is what do we do and how.
Every 6 seconds, another person dies from tobacco use. But there's something we can do about it. As tobacco taxes go up, death and disease go down. Any questions?
إن زيادة الضرائب على التبغ هو محور تركيز اليوم العالمي للامتناع عن التبغ لهذا العام. إقليم شرق المتوسط يحتل الموقع الثاني بين أدنى متوسطات أسعار السجائر، إذ يمكن الحصول على علبة سجائر في بعض بلدان الإقليم بأقل من $1 أمريكي واحد. وقد آن الأوان للعمل على تغيير هذا الوضع. إن زيادة الضرائب على التبغ التزام قانوني دولي.
A comprehensive mental health action plan for 2013 to 2020 addresses the heavy toll of mental, neurological, and substance use disorders in the region. We are now developing a practical framework of action.
There are two great challenges facing mental health services in this region. The first is the low awareness and demand for mental health care, and the second is the low availability of specialized mental health human resources. Evidence has shown that one particular innovation can help address both of these challenges, and that innovation is the use of appropriately trained and supervised community-based mental health workers.
The second UN Road Safety Week on pedestrian safety highlighted the importance of multi-sectoral approaches. Police and transport sectors can reduce road traffic injuries in coordination with the health sector. In 2013, the Regional Committee endorsed a regional strategy for health and the environment. Member states are now expected to develop action plans to put this into practice. Universal health coverage, with its emphasis on equity and quality, is now the umbrella for WHO's work in health systems and a priority area for WHO support to countries. A highlight of work in this area was an international event at which high-level representatives from 20 countries of the region, as well as international and regional experts and development partners, endorsed a framework for action to support countries in their move towards universal health coverage. The region now has a roadmap.
Well, the Eastern Mediterranean region is not a homogeneous region. You have countries that are very affluent, there are countries that are very resource poor. They have different health systems, different lines of funding.
Poverty and inequitable distribution of resources between urban and rural populations are major social determinants of health in the region.
For countries that were doing very little on social determinants, we say do something. Improve early child development, improve education, improve social protection. For countries that are already doing something, we say, do more. And if you're Sweden and you're doing a great deal, then we say, do better. I think there's something for everyone here. Do something, do more, do better.
Almost 58 million people in 14 countries in the region are currently affected by emergencies. The region now hosts more than half of the world's refugees and has the largest number of internally displaced persons globally as a result of conflict.
We need to ensure that we are looking at a comprehensive set of services for these refugees and ensuring that even within basic service provision, we are ensuring psychological and social considerations.
One of the main challenges in conflict-affected countries is the threat to healthcare workers and patients.
The health facilities in any kind of situation, including wars, should be respected. They should be totally depoliticized, and so we're very concerned that we have had a large number of health facilities affected, resulting in damages not only to the structure of the hospital becoming non-functional, but even more importantly in injuries and sometimes death to patients and health professionals.
In a region disproportionately affected by humanitarian crises, health diplomacy is of critical importance.
Looking at foreign policy through the lens of health is about enriching foreign policy, making it more relevant for the lives that people are living. Fighting war, fighting insecurity is a health measure.
WHO held the third regional seminar on global health diplomacy in May 2014, which involved senior diplomats and health officials.
The seminar on health diplomacy is a very interesting initiative.
This seminar here in Cairo at the EMRO headquarters has underscored a need for continued international approach to deal with rising and spreading health issues.
مفهوم الصحة طبعا اختلف، في السابق كان المعني بالصحة هي وزارة الصحة فقط. اليوم تدخل فيها من ضمنها الأشغال والبيئة ووزارات أخرى ثانية.
Collaboration between different sectors is essential to control that.
Do more.
Public health is a concern for all of us. It can only be created, maintained, and restored by working together to serve our people, to fulfill our noble causes, and to address our challenges. We are united for health.